Hey, friends, have you ever watched your dog stand up and then hesitate, then take that first step with a limp, and you know how fast your stomach drops? And when you take your dog to the vet, they say it's the knee, like an ACL injury. A lot of pet parents are immediately given one solution: surgery. But today, I'm going to zoom out and we're going to look at the knee as part of a whole body, whole lifestyle picture. And I'm going to break down a really cool veterinary clinical case study um, done by Dr. Shelby Watson in an article that she wrote for the Journal of American Holistic Veterinary Medical Association in the winter of 2024. And it shares 4 real dog stories where an integrative, non-surgical approach helped dogs with knee injuries or degenerative knee problems. They actually got to return to function. So they recovered from their knee injury, sometimes dramatically without surgery. And the case study is called An Integrative Approach to Canine Stifle Injuries and Degenerative Conditions, 4 cases of successful non-surgical outcomes. All right, so I'm going to talk about, the paper. So the paper focuses on dogs with knee issues, specifically involving the cruciate ligament or an ACL. And a big point that the author makes is that many cases aren't simply, oops, my dog blew out their knee playing fetch. Now, instead, we view cruciate injuries as part of a cranial-cruciate ligament disease, which is actually a degenerative process that builds up over time. So it's chronic and it has many causes, and it's usually just not one thing, and it's usually not just trauma. Trauma is the straw that broke the camel's back. It's like the last straw after all the other things happening that play into the weakness of that ligament. So if it's not a single traumatic event, the logic is that, we don't just repair the tear or the torn ligament. We also have to support healing and reduce inflammation and improve the movement or the biomechanics of the leg and of the whole dog, and lower the odds of future problems, which include arthritis of the injured knee, but also include the dreaded ruptured ACL of the other knee. That's a big problem. So this is a case report documenting 4 detailed cases from her clinical practice. And they show what a real world step-by-step plan looks like, and what changes over time and what outcomes she observed. And in other words, it's clinical evidence, which is the first step of collecting documentation or collecting evidence before we move into research. So these cases are presented by Dr. Shelby Watson from an integrative small animal veterinary hospital using a combination of conventional and holistic modalities. So let's get into it. I'm going to summarize these for you. So case 1 is a big guy. It's a Rottweiler, a 6-year-old neutered male Rottweiler that weighs 123 pounds, and he's overweight. He has already been through knee surgery. So he had a TPLO on the right knee 2 years ago, or 2 years earlier than when she saw the dog. And now the other knee has started acting up. And so the first plan was basically, calm the inflammation, take the pressure off the joint, give the tissues every chance to heal. And they used conventional pain control early on. So they used carprofen and tramadol while also making big lifestyle changes. So cutting back on the kibble, adding raw or cooked real food to his meal. They added omega-3s. They added connective tissue chews So things like raw turkey necks, and they added gentle home exercises. So like range of motion exercises where you take the leg and move it gently in a bicycle-like fashion. They also used Jin-Tong tendon ligament formula and cold laser therapy. And they treated not only the knee with the cold laser, but both knees, both hips, and the lower back, because dogs with a problem in a joint will compensate. So we want to treat the rest of the body that's compensating where the injury is. All right, so they did this for 10 weeks and he really wasn't improving. So because he was not the friendliest dog, they in order to do a better exam on his knee, they sedated him and did an orthopedic exam and did x-rays. And they found out that his knee that had had surgery had quite a bit of arthritis. And then the other knee that didn't have the surgery had quite a bit of pain, fluid in it, and had some instability. So they were pretty sure that that was a cruciate problem. So they added another round of the tendon and ligament herbs, the Jin-Tong tendon ligament formula, and they started a course of BPC 157 injections, so peptide injections. And the pet parent actually scheduled a surgery, a TPLO, for that left knee. But they canceled it because the limp resolved after starting the BPC 157. Yeehaw. So down the road, unfortunately, he had a flare-up, maybe a re-injury, and they repeated the Jin-Tong tendon and ligament herbal formula. They added thorn phytoprofen, which is bromelain, turmeric, ginger, and boswellia. And then they did another course of the BPC 157, but this time they did the oral form of peptides of BPC 157. And the pet parent said that he had the best mobility in years. So they followed this dog over time, and he had quite a bit of weight loss over time. So he actually got down to his ideal body weight of 99 pounds. And as he aged, like 5 years down the line from when she first saw him, he was needing more comfort care. So they added in meloxicam and gabapentin and CBD. All right. So the second case is a dachshund mix. And I call this one, and this is a quote from the article, an unplanned off-leash run instigated by a squirrel. So basically he chased a squirrel. So this is a 10-year-old neutered male dachshund mix that weighs 17.5 pounds. So he was overweight also. He was on a commercial raw food diet. He was already on some herbs. So he was on Jin-Tong Dongui Xiaoyaosan for slightly low thyroid and some phobia issues. And he went from normal to barely touching his foot down after a walk in the park or when he was playing in the park. And this is not the squirrel part. So he was playing in the park, got in the car to go home, got out of the car when he was home, and he was limping. So when he went into the vet, he had an exam and x-rays, and he had a knee injury. So the plan was to control the pain, reduce the inflammation, and keep the joint moving only safely, gently. They used herbal pain formulas, like they used plum flower, great corydalis tea pills, and they used an anti-inflammatory botanical supplement by MediHerb, the Boswellia complex. And they started a course of BPC 157 with TB 500. And they started cold laser therapy. And it worked fast. Like he was walking within days, walking and fully weight bearing in days. And he felt really good. And then he got loose and he saw the squirrel and re-injured himself. So the plan got a little tighter. They continued all these current therapies, including the BPC 157 and TB 500 peptide, and added Jintong tendon ligament formula and some home rehab exercises. And they also did some interesting modalities. They did fascial therapy and tuning fork therapy. They added PRP injections, which is protein-rich plasma, into the joint at about the 6-week mark. So by 6 weeks, they weren't happy with how things were going. So they added PRP and treated both knees because, when one knee goes, the other one will probably go next, unfortunately. So after this procedure where they injected the PRP, the protein-rich plasma, into the joint, he got some pain control, including gabapentin. And the outcome after all these treatments and after the PRP, the platelet-rich plasma, the pet parent said he looked normal again, running, jumping on furniture, and happy. And he only had a he slightly favored the leg. And so they plan to just repeat the PRP as needed or annually. And then by 11 weeks after the injury, you couldn't even tell that anything was going on. So he was back to normal activity. That's the squirrel guy. All right, the third one is a Jack Russell Terrier. So this is an 11-year-old neutered male Jack Russell Terrier that weighs 20 pounds. And he was fed 2 meals a day. One was a raw diet, and the other meal was a kibble diet. And he was already on some supplements before the injury. So he was on Thorn, Mariva, Mitapure, Urolethin A, and he was on Immune Assist Micron Mushroom Powder, and that's from Aloha Medicinals. And he was on Jintong Liver Happy and vitamin D3 based on some blood work. And he developed limping of his right rear leg that suddenly got worse, and the knee had fluid around it. It was painful. So they started him on plum flower great corydalis tea pills, which is an herbal pain formula. And they started him on an anti-inflammatory, the MediHerb Boswellia complex. And they started a course of BPC 157 and then some treats that would support connective tissue, like freeze-dried bovine trachea and tendons. They also did a series of cold laser sessions, and by about 6 weeks, he was almost back to normal. And then at 3 months, he was back to normal. You couldn't even tell anything happened. But then 6 weeks later, after a big beach run with a new younger dog in the home, he suddenly became lame on that other leg. The left knee then had swelling, pain, and a click. And so they were worried about a meniscal injury, which is like the cartilage between the bones in the knee. So they started a short course of carprofen and gabapentin. And they continued the Boswellia and the BPC 157 and TB 500 peptides. They did more cold laser therapy, and then they added PRP, or platelet-rich plasma, maybe a few weeks into that second episode. So after that, he could do multi-mile runs. He could go on trail runs. But the pet parent said he was sore for a day or two afterwards. So they added JOPE UC2 collagen chews. They continued the cold laser therapy as part of maintenance, as well as the other supplements he was on. And he actually worked back up toward bigger hikes. So he did really well. So the last case is an Australian Shepherd agility dog. And this is a 5-year-old spayed female Australian Shepherd, about 53 pounds. And she was actually active, but overweight, an overweight agility dog. And she was fed a rotation of raw food, dry kibble, and cooked fresh food. And she got treats and chews like freeze-dried beef or turkey tendons, beef hearts, beef kidneys. She got supplements, and this was all before the injury. She got supplements that consisted of collagen peptide powder. She got Cosequin, and then she went suddenly lame on her left rear leg during an agility drill, which is one of the moments that, sport dog pet parents just freak out, because that can be career ending for an agility dog. So she'd actually had an injury of that same knee 2 years earlier that fully resolved with cold laser therapy and physical therapy and Jin-Tong tendon ligament formula. And she had stayed on that herbal formula for maintenance, the Jin-Tong tendon ligament formula. So this time they did some imaging of the knee, and there was fluid, but there wasn't any bony problems. There was no arthritis. On the x-rays, the spine, however, showed spondylosis in several locations, which is an instability of the spine. So the plan ended up being a combination of conventional pain control with integrative support right away. So tramadol for pain, increasing the amount of the Jin-Tong tendon ligament formula, adding BPC 157 and TB 500 peptides. And they also added the PRP, or the platelet-rich plasma, early on, because the pet parent's goal was to return her to agility work. And so the PRP approach they used was really interesting. So what they did is they took the platelet-rich plasma, the PRP, and combined it with the BPC 157 and TB 500 peptide, and injected it into the knee joint and also along the spine where she had spinal problems, in the Watujaji acupuncture points. So that's a really interesting protocol, honestly. I hadn't heard of that. So the pet parent reported that she was improved within 4 days. And then she shortly after started a rehab program, and got acupuncture, electroacupuncture, cold laser therapy, and underwater treadmill work. And on follow-ups, she had a little bit of fluid around the knee, but no limping, good stamina, and she was expected to return to full work, so full agility training and agility competition. So these dogs didn't improve because of one miracle fix. They improved because their vet and family built layered, flexible plans that supported their comfort, their healing from multiple angles. So they used conventional pain relief as part of their toolbox when they needed it. So things like carprofen and meloxicam and tramadol and gabapentin, while they added other modalities to help the whole body heal and move better. So laser therapy, PRP, peptides, supplements, herbs, rehab, like the underwater treadmill, acupuncture, fascial therapy, tuning fork therapy. Let's see, there were herbs like plum flower, great corydalis tea pills, anti-inflammatory supplements like Medi-Herb Boswellia Complex, connective tissue support like Jin-Tong Tendon Ligament Formula, nutraceuticals like Thorn Phytoprofen, which is bromelain, curcumin, ginger, and Boswellia. Peptides were utilized in all 4 cases, BPC 157 and but the interesting thing is the pet parents in this report had areas where they had a lot of control, especially nutrition. So all of these dogs needed weight management, and that was a big win. And so the approach with food, in most of these cases, was to move away from kibble and towards the fresh food diets. And joint support was something that was used, and this is totally in your hands. I mean, these are over-the-counter supplements. So omega-3 fatty acids, adding fish and eggs and canned sardines to the food, using treats like raw turkey necks and freeze-dried bovine trachea or tendons. And so the big takeaway is, with the right mix of medications for comfort and modalities like herbs and supplements and rehab and PRP and peptides and smart nutrition, dogs can get back to a normal life and heal from a knee injury without surgery. And the nice thing is, and the difference is, between conventional and holistic, in the holistic approach, like we just went over, each dog's plan is customized to them, and it changes based on how they progress. Whereas conventionally, if a dog blows out its knee, has an ACL rupture, they go to surgery and usually get a TPLO. There are a handful of different procedures, but the TPLO is the most common one. So they all go to surgery and all get this, basically the same procedure. So there's no personalization with that. All right. So those were 4 really interesting cases. And the reason I pulled that article is when I was looking for research on peptides, and all 4 of them received peptides as part of their protocol. And so let me get you a free guide. There we go. There's a QR code for my Set Your Pet Up for Success with Peptides free guide. And I'll put the link below. All 4 of these guys got BPC 157. And I think 3 out of 4 of them also had the TB 500. So real interesting. And that seemed to make a real difference in speeding the rate of recovery, because in general, tendons and ligaments do not heal very quickly. All right. So that was an article from the Journal of the American Holistic Veterinary Medical Association from 2024, the winter of 2024. Dr. Shelby Watson wrote that. Really interesting stuff. So thanks for listening, and I will see you again soon.